A bill to create a state-controlled health insurance plan could be in trouble tonight. 3 of the 4 Democrats on the Senate Health Committee say they have serious concerns about this bill. Political specialist Sean Boyd joins us live tonight from the Capitol. And Sean, this bill has undergone a lot of revisions since it was introduced.
Yeah, Karen, you might remember initially it included a state-run health insurance option, but that was scrapped and replaced with a standardized plan that every insurer in the state would have to cover. Not only would the state dictate how much insurers could charge for that plan, but how much providers would get paid. And anyone who didn't go along would face thousands of dollars in fines. Hospitals could even be shut down. The Democratic chair of the Senate Health Committee told me that's going too far.
Can you imagine us suspending a license for a hospital?
Senator Rhonda Fields says providers have been through enough in the last year, and threatening them with punishment if they refuse to take lower pay is piling on. Under a new bill, the state would create a standardized health insurance plan that every insurer in the state would have to offer at a premium 18% lower by 2025 than the plans they carry now.
I'm not quite sure how they arrived at that number.
Fields says there's a lot about the bill that's unclear, including what the standardized plan will even look like.
It's like navigating in the dark.
What we do know is the state will set reimbursement rates as a percentage of Medicare's, and every provider in the state will be forced to accept them or face a $5,000 fine. For hospitals, it's $10,000 to $40,000 a day. They could even lose their license to operate. Fields says there shouldn't be forced participation, but bill sponsor Carrie Donovan says everyone needs to have skin in the game.
The fines that are contemplated are the very end of the line after voluntary negotiations and 2 different public hearings.
The bill would only cover individual and small group markets on the state exchange, about 15% of Coloradans who have insurance.
We do believe that because this is a small portion of most people's business, that they'll be able to absorb and figure out how to make this work across the business.
But insurers say the reimbursement rates aren't low enough in some parts of the state for them to meet the 18% reduction. And providers say they're too low for them to stay in business because they already take reduced rates from Medicaid and Medicare, which cover 30% of Coloradans. But Donovan insists the bill strikes a good balance.
So we took weeks to reach compromises.
Will you vote for it?
You know, we'll see what it looks like after it's fully amended.
Now, while the bill does not directly impact the majority of Coloradans who get their insurance through their employers, the concern is insurers and providers will look to them to make up some of their losses. Donovan says the bill prohibits cost shifting and that the insurance commissioner will know if it's happening. All Senate Republicans oppose the bill, so if even 2 Democrats vote against it, it will fail. The bill will be debated on the Senate floor next Tuesday. Live at the Capitol, Sean Boyd covering Colorado First.
Thank you, Sean.